This is one of the rarest skulls on display at the Bone Museum. Craniofrontonasal syndrome, also known as CFNS, is a rare craniofacial developmental condition caused by the EFNB1 or EphrinB1 gene. Now, to help you better understand the condition, let's take a look at some of this individual's features. The eyes are set wider apart than usual, a condition called hypertelorism. The face is asymmetric, and we can see that the right eye orbit is noticeably smaller and sits slightly lower than the left. There is an additional nasal opening and a severe cleft palate. On the back of the skull, we can see unicoronal craniosynostosis, where only one side of the coronal suture is fused prematurely. Additionally, we can observe partial suture fusion on the other suture lines, notably the sagittal suture. This patchy and irregular suture fusion is a manifestation of a condition called mosaicism and irregular cell duplication. There is also an accessory foramina on the sphenoid bone. What makes this especially interesting is although the EphrinB1 gene is linked to the X chromosome, it still affects females more severely than males. Normally, X-linked mutations show up more strongly in males as they only have one X chromosome and no backup copy. Females have two X chromosomes, so you would expect the second normal one to compensate. However, due to a process called X inactivation, only one chromosome is active in each cell. This creates something called a mosaic effect, where some cells express the normal gene while others express the mutated one. This is why we see so much asymmetry in the skull. This patchwork of cells doesn't work together properly, leading to more dramatic asymmetry in females. If you didn't know that this condition existed, you have to send this video to your friends. Other conditions we considered for this individual were Apert and Cruzon syndrome. However, they typically result in symmetrical craniosynostosis and don't typically produce the kind of facial asymmetry seen here. Remember now, craniosynostosis is the premature fusion of the sutures of the skull that can lead to misshapen skulls. Altogether, the unicoronal craniosynostosis, the hypertelorism, accessory opening, facial asymmetry, and cleft palate are all traits that are consistent with craniofrontonasal syndrome. With conditions as complex as this, it is sometimes very difficult to narrow down the exact diagnosis without looking at the entire skeleton, but this is what we have been able to identify using just the skull alone. If you found this video interesting and you would like to come see this skull in person, make sure to visit us at the Bone Museum in Brooklyn, New York.